Today, we're going to be talking about the rib flare, and more specifically, we're going to be talking about two exercises that I use with my clients in order to get fast results and long lasting results. Hi, I'm Alex Zephyr, founder of Resilient Training and Rehab, and I've helped thousands of practitioners from around the world get faster, more consistent results with their clients. Let's get into it. Before we get into those exercises, we're going to discuss what rib flare is and some of the underlying mechanisms behind them so we can understand what these exercises are inherently doing. We're looking at a rib flare. First, we have to focus in on the lower part of the rib cage. So this lower part of the rib cage, also called the infrasternal angle, is attached through cartilage. And so because it doesn't directly attach to the sternum, they're actually a little bit more malleable. There's a lot more movement and compensations that can happen at this lower part of the rib cage. And so why the lower part of the rib cage is important is because when we're breathing, when I inhale, they're going to open up. When I exhale, they're going to close. However, when you have somebody who has a lot of stiffness, maybe they're doing repetitive activity, maybe they're doing weightlifting or just overall stiffness, maybe they're just heavy chest breathers, then what you may see is you actually may see their center of gravity move forward. So they're actually going to arch through their lower part of their rib cage, and that's going to cause their ribs to flare forward. So essentially, they're going to gain a lot of tension through this lower part of the rib cage. That is then going to push the rib cage forward. And what that inherently does is it's going to basically lift the chest up. Okay? What this does is this causes a lot of compensations around the neck, it causes a lot of chest breathing. But what it also will do is it will change the position of the shoulder socket and make it a little bit more into this external rotation position. And why that's important is because if somebody wants to reach their arm at 90 degrees or they want to internally rotate their shoulder, so think of like pressing, doing a dumbbell press, doing a push-up, what you may see is they may not have access to that range because it requires internal rotation. And from there, that may lead to them using a rounded shoulder, their shoulder blade coming up and over the rib cage. You may also see them maybe arch their back excessively when they come up from a deadlift or even as they go down in a push-up. And so this rib flare is going to impact shoulder mobility. It will also impact hip mobility, but we're going to focus on the upper body for now. So when I'm looking at somebody who has a rib flare, especially when they're laying down, one of the measurements that I'll often look at is their ability to internally rotate and externally rotate the shoulder. Now, sometimes you may see a limitation in both internal and external rotation, and that could be because they're in a rib flared position and some other secondary things are maybe happening. Maybe they're in this rib flared position and their shoulder blades are really squeezed together. Sometimes they'll shrug up. Other times their shoulder will round forward, and all of those will have different impacts at their shoulder mobility. Sometimes they'll have less internal rotation, but they'll have a lot of external rotation. And that's because when they lay down on the ground, their lower part of the rib cage is actually off the ground, but they rest more on the top or the base of their neck. So they kind of arch their back. And so now the top part of their back is on the ground, their pelvis is on the ground, but this lower part of the rib cage is off the ground. When this happens, this is going to, again, cause the shoulder socket to face in a different direction. It's going to make it face it up and out towards the side. So this position, often called retroversion of the socket, that is going to bias the humerus into more external rotation. So you may have somebody who has a lot of external rotation. It may even look like they've got laxity and have excessive amount of shoulder flexion. But really what we're seeing is just the position of the rib cage. Their rib cage is basically flaring up, putting their sockets back, and then they've got a lot of external rotation. But then if I were to put my hand on their rib, pull it down a little bit, we're going to see that that external rotation is not actually excessive, but actually rather limited. And so the position of the rib cage can really drastically influence the shoulder mobility. And so when we're looking at the rib flare in order to reverse engineer it to improve it, there's a couple main things we need to think about. First, we need to shift the center of gravity backwards. These people are flaring their ribs and their center of gravity is going towards their toes. And so what we need to do is find a strategy to bring the rib cage back so they shift their center of gravity back. Now, oftentimes, people will cue the ribs to come back, and what they're inherently doing is getting them to crunch down. That's not what I'm talking about. I'm thinking more the sternum stays tall as I shift my ribs back in between my shoulder blades. So my chest bone goes straight back rather than going down. So first I need to shift the center of gravity back, which is going to inherently internally rotate the ribs instead of them being up and out in an externally rotated position. And I need to open up the back part of my rib cage. I need to open up in between the shoulder blades and even in between the pelvis so that I can reduce the amount of tension back here that's pushing everything forward, and I can shift everything back, and that is naturally going to restore the shoulder's ability to internally and externally rotate. So the first exercise we're going to cover is the low cable reach. It's one of my favorite exercises in order to shift the center of gravity back, open up in between the shoulder blades, and get those obliques to pull the rib cage back. So what I'm going to do is I'm going to put the cables all the way up to the top. I'm going to lay down on my back, and the cables are going to passively pull my shoulders forward. I'm not going to let it pull my back off the ground, but I'm going to let the cables pull my scapula around the rib cage as my back stays in contact with the ground. Okay, so what I'm going to do is take the cables, I'm going to lay down on my back, I'm going to make sure that my upper part of my rib cage and even the tag of my pants are on the ground just so that I'm not flaring. And then what I'm going to do is I'm going to let the cable pull my shoulder blades off the ground. So again, I'm not allowing it to pull my back up. I'm not tilting my head back. Sometimes people may have to put their pillow or put their head on a pillow. So what I'm going to do now is I'm just going to push my feet into the ground, push the tag of my pants into the ground, let the cable pull my shoulders forward. I'm going to take a big breath in through my nose as I let the cables pull me even more. I'm going to breathe out as I press my feet into the ground without lifting up my bum. And I'm going to exhale and allow my ribs to come down. Again, I'm not crunching and causing my sternum to go down. I'm just going to exhale and feel my obliques pull the ribs down. So breathe in as the cables pull me. Breathe out as I exhale as my lower ribs come down. And it's important also, you can notice that my arms are in more of the 60-degree range. So they're in line with my lower rib cage. They're not up here at 90, but this lower reach is going to further allow me to shift my center of gravity back, reduce the tension around that lower part of the rib cage on the back side, and get a little bit more obliques to fire. So what I get my clients to do is I usually get them to do about 2 sets of about 8 big breaths. And so about 3-second inhale, 3-second exhale. So the second exercise, you're going to grab a pillow, you're going to grab any type of foam mat or foam pad, and what you're going to do is you're going to stick it into your hips, because what we're going to do now is we're going to really try to emphasize opening up that lower rib cage. By opening up the lower rib cage and in between the shoulder blades, that is going to further shift our center of gravity back and allow the ribs to drop back naturally. So I'm going to take the pillow, put it in between the crease of my hips. I'm then going to fold over it. So I'm not going to come up and over. I'm going to try my best to keep my bum close to my heels. If it doesn't feel comfortable, you can put another pillow underneath your hips just so you're able to have a little bit more relaxing and it's going to be less pressure on the knees. And I'm going to fold over, and now this pad is going to push my ribs up. So automatically when I breathe in now, I'm going to feel all the air go in the lower rib cage. Because again, when my ribs flare, this is going to be compressed. So every time I breathe in, it's all going to be going in the front of the rib cage, which further reinforces that rib flare. So pad in the crease, I'm going to fold over, arms are going to be down. I'm going to take a big breath into my nose. And just so you're not really collapsing down, I want you to push your elbows into the ground so you get nice and tall through your shoulders. Take a big breath in through your nose. Breathe out all the air and try to allow your chest to sink closer to the ground. Again, that's going to further push the ribs up towards the ceiling, and it's going to open up the lower rib cage. So about 2 sets of about 8 breaths. Again, emphasizing the inhale, 3-second inhale, and then a 3-second exhale. As I sink down a little bit, not shrugging, staying nice and tall. If you found these helpful, don't forget to like, save, and subscribe, and I'll see you next time.